You look so stressed out. That's me.
Okay, I thought, yeah, anyway, it doesn't matter, like really.
You look like doing this uh, um, gunpoint. Somebody's threatening you.
No, it's what happens to me when I'm on radio. I'm like, I'll be thinking I'm going to be speaking for 10, 15 minutes. They're like, yeah, you have the whole 30 minutes. I'm like, to say what? What?
Okay, let me tell you what to say. It sounds weird, but
It's fine. Then I'm just going to
Mosele, how are
recite it.
you?
I'm good at yourself.
Just happy to speak to you finally. You must a very busy nurse, always studying, working
Uh,
night shift.
I'm not that busy. I'm just very booked currently.
Okay. So,
Yeah.
where are you from, Mosele?
I'm originally from the Free State
Yeah.
in a place, a small town called Kwakwa.
Okay.
Yeah.
And yesterday I had this into not this chat with judo, and I asked her, where are you stationed?
Oh, okay. I'm currently in Pretoria. I stay in Yellowsdale. That's where you'll also find Mose Health Consultancy. I work for Dr. George Mukari Academic Hospital. It's in the rural parts of Pretoria. It's an academic hospital, but very rural area.
So, what type of
Yeah,
nurse are
there's
you?
even monkeys on the premises. Like that's like we Tarzans there.
So, what type of nurse are you?
I'm a nurse midwife. I have psychiatry nursing as well, and I
Mhm.
have community health nursing. I also have integrated management of childhood illnesses as a certificate, but I'm actively practicing as a midwife. So all these other things that I have, they just help me do my job better.
Okay. So, what's the message? Um, let's say now I'm on the floor and you see me, I'm stressed out today. What's the first thing you will do? What's the words of encouragement you will give?
Okay, usually what I always say to my team, because I'm always team leading, either team leading um, other midwives, or I'm team leading student midwives and student doctors.
Mhm.
Usually what I tell them is, um, on any maternity floor, we are the advocates of bringing life onto this earth and making sure that that life is sustained properly in the first seconds that matter, right? Therefore, if a child is delivered properly and everything goes well, then it means we have contributed 100% to the future of this country.
Mhm.
So I always try and make sure that everybody understands how important their role is, and around any important role, there's always many dynamics that need to happen,
Mhm.
many stressful events that need to happen. But at the end of the day, the ultimate goal is having a healthy baby and having a healthy mom. So we try and every day need to balance our own mental health illness continuum so that we give the utmost to our patients,
Mhm.
right? We're not always given the best circumstances, but I think under any circumstance, a smile, a slight joke, a chirpy chat with a patient or a colleague always does it. So it's the simple things. It's the not panicking, it's the trying to remain calm, it's the always asking for help, it's the please and thank yous that make a day, really. Taking it one day at a time. Like even when we're swimming through, I remember, I think 2 days back, we were 60 patients on the floor. I think about 14 high care patients. Others were not in beds, in corridors, on benches, everything. I told them, when you touch a patient, make sure that you do it to the best of your ability. Don't worry about the others that are waiting in queue.
Mm.
Every patient that you touch, make sure that you give it your best. You can't give it your best to all 60 of them. There's only one of you, and that's 60 times 2. That's mother and child. So that's 120 lives, all dependent on 10 midwives. That's not possible. But it is possible to give the one patient that you have in your hands at that current moment, to give it 100%.
Mm. Okay.
Yeah.
So basically, your encouragement is I, as a nurse, sounds weird because I'm not. To work with somebody, I must focus where I'm my best there.
Yeah.
Thank you for the words of encouragement.
It's a pleasure. I've enjoyed the other chats with the other people you've been chatting with.